Good afternoon. I'm Doris Zjalić, and I'm a public health resident at Università Cattolica del Sacro in Italy. I'm very happy to share with you the results of a pilot project focused on the climate crisis and health literacy and its effects on negative emotions and pro-environmental behaviors among a group of Italian students, high school students. This project stems from several considerations. On one hand, Italy is a hotspot for climate change. In 2022, we had 310 extreme weather events and 29 fatalities. On the other hand, we know that education is essential for enhancing preparedness and adaptation, but we know also that education about climate change can increase worry. The question we posed was, can we provide information that motivates students to take action without exacerbating the negative emotions? With this in mind, we developed the PERSIST project, which aimed to pilot and measure the impact of a school educational intervention on youth climate-related emotions and to assess its efficacy in strengthening literacy on the climate crisis, applying pro-environmental behaviors, and promoting system thinking in high school students in Italy. This pilot project was conducted at a scientific high school in Rome, Italy, between March and April 2023. We involved 10 classes from grade 1st to 4th, comprising a total of 273 students, aged between 13 and 18. The intervention consisted of 3 sessions conducted by public health residents that was previously trained. And to evaluate the intervention effectiveness, we administered a questionnaire immediately before the first session and another after the final session. The questionnaire assessed climate change literacy, knowledge of climate crisis impacts on health, pro-environmental behaviors, and emotions related to the climate crisis. We use student-centered approach with a preference for group work, active discussions, complex system-based games, and a question-oriented methodology. Through guided discussions, students could deduce answers utilizing complex system models, brainstorming, and group activities. And analyzing our questionnaires, we noticed that there was an improvement in climate crisis literacy, particularly in knowledge of climate crisis climate change's health impacts. Mean knowledge score on climate change impact increased after the intervention, and mean knowledge scores on the health impacts on climate change also improved with a medium effect size. And no discernible differences between pre and post intervention in climate-related emotions were found. Okay, our findings suggest that the relationship between health effects of climate change and pro-environmental behaviors is mediated by self-efficacy, as indicated by this simple mediation model. In conclusion, using an interactive system thinking approach to comprehend crucial facts of the climate crisis, such as carbon footprint of the Anthropocene, as well as its effects on the biosphere and human health, has the potential to enhance climate crisis literacy and awareness without intensifying negative emotions. And the adoption of a system thinking approach has the potential to foster creative thinking among students. While this study didn't delve into this aspect, future research could explore whether the application of system thinking might enhance individual sense of agency in positively. And to conclude, I would like to thank my colleagues Gaia Lombardi, Mattia Di Russo, Alessio Perilli, Lorenza Nachira, and our supervisor, Professor Cadeddu.